Hi, I'm Dr. Julie Steinauer. In tonight's video, I want to talk to you about the different levels of vision therapy programs that we have. I don't know that I've ever kind of combined this all in one. I think I've done it in multiple videos, but I thought it was about time to discuss all the different options that we have available for programs with our clinic. Now, before I get into that, let me tell you how you can connect with me. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. When you get to the website, you'll have two choices. You can either fill out a questionnaire and get information from us, or you can take the next bold step, which is scheduling a consultation time directly with me. Now let's go back and talk about the various programs that we offer. We're going to kind of start at the bottom and build our way up. So our lower tiered kind of entry level program is one in which it either is being offered to infants because we are trying to help babies and usually under 2 years of age children to be able to maybe maintain better eye alignment, or we might be working on the nystagmus, like an eye movement if they're having a twitchy eye. And so that's an entry level for someone who's really young. In that program, what we're doing is that we're utilizing syntonics, which you hear me talking about all the time, and we offer a couple of sessions. There are 2 sessions during a 10-month time frame that we work with you in giving you some activities to work on with your infant. But mainly during this, we're giving you some supportive ideas of things to do with your child and having a particular schedule that you follow for syntonics during that 10-month time frame. Now, also at level 1 is an adult restoration program. This adult restoration program is appropriate for adults who have had significant vision loss. And by significant, what I mean is they may only be able to see light. So it's called light perception or hand motion. Okay, and in those particular cases, it could have come from traumatic brain injury, maybe optic atrophy, maybe a stroke actually has caused that level of degradation of eyesight. And so that is an entry level for adults. It's similar to the infant program in that it's only syntonics for 10 months. And then we meet with you for 2 sessions to give you ideas and activities on things that you can do to enhance and improve vision, and hopefully take you from, severely limited vision to having better vision and seeing a little bit more details. Now, our level 2 program is existing on 2 areas, I guess in 2 areas. One would be for toddlers. This is appropriate for about age 1.5 to around age 3. Or if your child happens to have some developmental delays or is just really precocious and does not sit still and listen to instructions very well, might be a little bit of an older child in there, like in the 4 range, that could possibly, be appropriate for them to start out at the toddler level. This level of program is also a 10-month program. It's designed to use syntonics, but it's also designed that we meet with you. A therapist meets with you once a month and provides you some activities to work on with your child to enhance and improve their vision. It may serve as a continuation from level 1 infant program into the toddler program, so it may grow with you, or some people come to us during that toddler phase and we need a specific program, very specific for the age and development that they are and the visual problems that they're having. Now, we also have an adult level 2 program, and an adult level 2 restoration is designed such that the person who maybe in level 1 had light perception only or only hand motion visual acuity, and now that individual might be able to see shapes, outlines, colors. Or perhaps you're coming in with the ability to see shapes, outlines, colors, or like a big E on the eye chart, but not being able to see anything else. Again, this may come from traumatic brain injury, something like a stroke, or even in cases of like an optic atrophy. Some cases of they've had a brain tumor and the tumor was removed and it affected their eyesight. So that would be kind of considered almost like a traumatic brain injury. So that program, level 2 adult restoration, is appropriate for those. Now moving on from that, we have a 20-week program. This program is typically only offered in instances of patients who've had vision therapy before, and they might need a good kind of chunk of time in therapy, but they don't necessarily need a full therapy program. So that is sometimes offered for those individuals. Or it could be offered from someone like who has kind of progressed through these other levels, like a level 1 adult or a level 1 infant to the level 2, and now they need a step in between. Most of our patients do jump right into a program, which is our 45-week program. And what that program is designed to do is that's designed for pretty much all of our cases incoming, whether it be amblyopia, strabismus, binocular vision problems, traumatic brain injury, visual field loss due to stroke, optic atrophy. Most of our cases are going to fall in that, as long as there's a certain level of entering eyesight that is making it easier for us to expand upon and improve. Now we are going to be very soon introducing another level of program, and this is not one that we've ever had in the past, but this program will be a 70-week program. It's going to be designed for our really truly difficult cases that come to us, such as perhaps maybe like a Duane's syndrome, which we do work with some regularity. Could be some cases of traumatic brain injury, and there could be some other cases that might fall into the category of that 70-week program is best to be utilized, and that can be utilized by adults or kids, just like the 45-week program can. Typically, the age range for the 45-week program starts off around age 3, but they have to be a pretty mature 3. Or it can be around age 4 if they happen to be a little bit developmentally immature coming into things. And then on the upper end, as far as adults, there's no age range that we won't work with. We do work with patients of all ages, from about 4 months of age up into adulthood. So for more information about our programs, you can go to our website at visionforlifeworks.com, and you can do one of two things there. Obviously peruse through our success stories, take a look at all of our videos that are posted there. You can look through a lot of information there, which we will be kind of unveiling a new website here in the next month or so. But in the meantime, you can go there and you can click on the schedule a consultation button, or if you want to just take a questionnaire and kind of find out more about your vision, you're welcome to do the questionnaire, which will provide you with some feedback on how your visual problems might be affecting you. Now, if you're local to us, it's obvious that we'd want you just give us a call. Call us at 618-288-1489. You don't need to jump through those other hoops necessarily. Give us a call first, and then we'll connect back with you. I do want to say that when you are local and you give us a call, we typically have a callback time of approximately 3 to 5 business days because of the blessing of volume that we have that comes into our clinic on a regular monthly basis. So please keep in mind that we will get back with you as soon as we possibly can. Now, if you like this video, hit the like button. If you've not done so already, hit the subscribe button and subscribe all so you can get all of our notifications, or all notifications about all of our videos. And if you find that this could be helpful, please pass this video along to someone else. Thank you.